The changes include exemptions, and there will now be a study to determine how much workers and employers have to pay into a fund to make it all happen.
I think the pandemic really showed how people had to make difficult choices dealing with loved ones that are sick or dying and still paying their bills. So it really shed light on the value of family. We've also lost a lot of people in the workforce. So I'm hoping this entices them to come back because people are choosing family over the workforce. And what I'm hoping is they realize they don't have to necessarily make that choice.
The Time to Care Act has dramatically changed. Although it still provides 12 weeks of paid leave to workers to deal with family health issues, there are now exemptions. The House rolled provisions of their bill into the Senate version. Changes include requiring the state to pay the contribution of those making less than $15 an hour. Self-employed individuals can opt out. Businesses who have 15 employees or less do not have to contribute to the fund. Workers who take the leave will receive a percentage of their salary. And the General Assembly will revisit the issue every 2 years to make sure the program is working and the $1.4 billion fund generated by employee and business contributions is viable. Small business owners oppose the bill, calling it a billion-dollar payroll tax.
When we look at the bill, it's frankly a one-size-fits-all mandate that puts small businesses in particular at a disadvantage because it assumes that an employee at a small business is replaceable for up to 12 weeks every year, in some cases 24 weeks.
The cost of businesses and employees will be the focus of a study for the next 7 months. That money is expected to generate the $1.4 billion for a state-run paid medical family leave insurance fund.
This is beneficial to all working Marylanders. You never know when life's going to happen to you, so you never know when you're going to have to take care of your mom, your child, your brother or sister.
When the House has finished working on the bill, it goes to the Senate and they need to vote on those changes before it can be sent to the governor. No word on the governor's take on this bill. Now, the study will be finished by October, but lawmakers can't do anything about it until the next session in January. Reporting live from Annapolis, David Collins, WBIL TV 11 News.